Welcome to the Shark Nation and the NSU Office of Human Resources Benefits presentation. During this presentation, you will receive an overview of the NSU employee benefit plans and programs. Learn where to find more details about the programs and how to enroll. However, before we begin, you should know that the university offers its health benefits through ICUBA, a consortium of 10 colleges and universities and 17 secondary schools. The ICUBA consortium covers about 10,000 employees and their families and is still growing. Listed here are the products and services ICUBA provides. We will discuss these programs as well as those offered by NSU during this presentation. Just in case you are curious, the ICUBA member institutions are listed here. Before we get too deep into the weeds speaking about specific benefit plans, this is where you will find just-in-time benefit information. The Benefits and Wellness website can be found on the Office of Human Resources landing page. Everything you need and hear about today, including the presentation, can be found there. And the ICUBA portal is where you will go to make your benefit elections. You may remember signing the benefit information form in your new hire package. This form was your first notice that you have 30 days from your date of hire to make benefit elections. Consider this as your second notification that you have 30 days from your date of hire to make your benefit elections. If you missed this enrollment window, you may make elections during the next annual open enrollment period for an April 1 effective date. To make your elections on the ICUBA portal, follow the login instructions found on the landing page in the lower left-hand section, which is outlined in the red box. You will find that the portal has an excellent decision support called Ask Emma. Emma will model your election options based upon utilization data that you provide. You may find this tool very helpful when considering your available choices. If you have dependents and plan to cover them, you'll be asked to provide your attestation that they are eligible dependents. Eligible dependents are your legally recognized spouse or domestic partner, your natural child, stepchild, legally adopted child, your legal ward, foster child, or child covered by qualified medical child support order. Your dependent child is considered an eligible dependent until the end of the calendar year in which they turn 26. Your adult child who is disabled and incapable of self-support may also be eligible dependent if documented by SSI or SSA. Have your dependent Social Security number handy when you sit down to enroll because you will need to provide it. If you do not have a Social Security for your dependent, please contact a member of the benefits team who can assist you. Team members are listed on the benefits webpage. NSU offers 3 medical PPO insurance plans through ICUBA that are administered by Blue Cross Blue Shield. Each medical insurance plan includes prescription pharmacy benefits provided by Optum Rx, and behavioral health services are provided by Aetna. Aetna is also NSU Employee Assistance Provider, or EAP. All employees, even those who do not enroll into a health plan, and any member of your household may use the EAP. The Premier and High Deductible Plan are co-pay plans. The Preferred Plan is a co-insurance plan. All 3 plans provide the same access to no cost and no deductible benefits, prescription drug, and behavioral health benefits. The plan differences are found in the deductible, out-of-pocket maximums, co-payment amounts, and the premium costs. These summaries are abbreviated. You will find detailed summaries on the ICUBA enrollment site and on the NSU benefits webpage. Here are the employee monthly premiums by plan and election tier. The Premier PPO plan is the green box. The Preferred PPO is the blue box, and the High Deductible plan is the orange box. The coverage tiers are listed along the left side of the boxes. Please note that dual enroll coverage tier is only available to married employees who both work at NSU and who would cover themselves and their eligible dependent children. The column headed HRA from NSU refers to a health reimbursement account that is funded by NSU. This contribution is available to faculty and staff who enroll into one of the medical plans. The funds are deposited monthly and can be used to pay for unreimbursed medical expenses, co-payments, deductibles, and coinsurance. Newly eligible employees will see their first deposit at the end of the month following their enrollment. We will talk more about the HRA and how it is used later in the presentation. But before we move on, I want to point out the card samples along the bottom of the slide. The first card is a Blue Cross Blue Shield card. This is the medical insurance ID card. The second card is the OptumRx, which is the prescription drug card. And Aetna is the behavioral health card. And the last card is the ICUBA MasterCard. It is this card that provides you access to the funds in your HRA. There are some important points to keep in mind about collection of premiums. Coverage and premium collection begin on your hire date. So if you enroll towards the end of the 30-day enrollment period, a premium payment may be missed. If this happens, we will contact you in advance to notify you that we will be collecting the missed premium. ICUBA designed its own plan, one that is value-based. By providing free and low-cost wellness services, ICUBA eliminates barriers to care. Easy and inexpensive access to your wellness services means your emergent health issues can be identified and addressed early when better outcomes can be achieved. We encourage you to use those wellness benefits. The list of services available at no cost includes your annual wellness exams, visits to a Blue Distinction physician, labs, diabetic supplies, and access to a pharmacy advocate who can assist you in lowering your pharmacy expenses. NSU employees have access to free surgical care through our Surgery Plus network, and all NSU employees and their household members have access to our Employee Assistance Program. Surgery Plus is a specialized network of surgeons that every employee enrolled in a medical plan has access to at no cost through the ICUBA medical plans. The program is an opt-in program, and when assessing services through Surgery Plus, deductibles and out-of-pocket expenses are waived. Surgery Plus care advocates will coordinate medical record transfers, schedule consultations, surgeries, and post-operative follow-up and care. If travel is required, Surgery Plus will also make travel arrangements for you and one companion. Hundreds of surgeries are available through the network, but services for the eyes, maternity, and cancer are not. In addition to the no-cost benefits, many services are available where no annual deductible is applied. Only a coinsurance or a copayment is charged for these services. Teladoc gives you access 24/7 to a U.S. board certified doctor through the convenience of phone, video, or mobile app. Visits for a low copay of $5. Set up your account today so when you need care now, a Teladoc doctor is just a call or a click away. The pharmacy benefit is the same for all three PPO plans, and the copayments are listed here. Consult with the ICUBA Cares Pharmacy Advocate who can help you navigate copay tiers, obtain prior authorizations, and identify lower-cost drugs. Call 877-286-3967. Or if you prefer to meet with an advocate in person, they are located on the main campus of Davie in the NSU Pharmacy. Also important to note, you can fill your preferred generic prescriptions for free at NSU Pharmacy on the main campus. Aetna is our behavioral health and employee assistance program provider. As mentioned earlier, all employees and their household members are covered by the EAP. Access to the EAP does not require a medical plan election. When participants need to access the behavioral health benefit available through the medical plans, Aetna makes the referrals for counseling services, psychiatric medication evaluations, applied behavioral analysts, and intensive services that may require hospitalization or residential treatment. Aetna also provides a service platform called Talkspace, designed for members comfortable using technology. It is an online service model that connects members with licensed therapists. Let's talk about health reimbursement accounts and flexible spending accounts. There are similarities and differences. The funding source for these accounts is a key difference. NSU funds the HRA while employee fund the flexible spending account or FSA. There are two types of FSAs, a healthcare FSA and a dependent care FSA. The Internal Revenue Services set annual limits on how much can be contributed into an FSA, and these limits change from year to year. The funds in a healthcare FSA are available to spend in full following your election, and the funds in an HRA or dependent care FSA funds are available to spend as they are deposited into your account. The way you use the HRA and healthcare flexible spending account is similar because they both can be used to pay for unreimbursed medical expenses. But if you're using the HRA to cover dependent expenses, the dependent must be covered by your medical plan. The healthcare FSA funds can be used for non-covered dependents. A dependent care FSA is used for the care of a dependent under the age of 13, but not for healthcare related expenses, rather for expenses like child care, after school programs, and summer camps. FSA funds must be used up completely. They do not roll over from year to year. For example, our plan ends March 31st. After that, you will have until June 15th to incur expenses for the current plan year and until June 30th to request reimbursement. Any FSA funds remaining in your account after June 30th will be subject to forfeiture. This is an IRS rule, not an ICUBA or NSU rule. So it is important for you to budget wisely. HRA funds roll over from year to year, and after 36 months of participation in an HRA, the account is considered vested. In other words, you own the account and can take it with you when your employment ends. This is the ICUBA MasterCard. With this card, HRA funds and flexible spending account funds can be assessed. Anecdotally, I have learned that many of my colleagues throw out their card mailer thinking it's junk mail. So please look for the ICUBA logo before you toss. Reimbursements can be filed online if you use another form of payment and want reimbursement. You can access your ICUBA MasterCard account on the ICUBA portal using a single sign-on. The dental and vision plans are optional plans and the premium is employee paid. Humana is our dental provider and there are 3 dental plans to choose from. There is a dental DHMO that requires that you select a primary care dentist. There are no deductibles and annual maximums in this plan. Services are reimbursed according to the DHMO schedule. You will find a copy of this schedule on the benefits website. This can only be used in the state of Florida. The preventative PPO covers only basic and preventative services. So if you think you may need a crown in the coming year, consider one of the other plans. The preventative PPO has an annual maximum of $1,000. The high option PPO covers basic, major, and preventative services, and the annual maximum is $2,000. The DHMO and the high option PPO both have orthodontia benefit, and none of the plan covers implants. IMED is our vision plan provider, and there are 2 vision plan options, the base plan and the enhanced plan. The difference between the plans is the frequency in which you can obtain new frames. The base plan offers new frames every 24 months, and with the enhanced plan, new frames can be obtained every 12 months. Premium rates shown here are monthly, and complete details of the plans can be found on the ICUBA portal and on the benefits website. The NSU Dental faculty practice are participating providers in the preventative and high option PPO plans, and the NSU Eye Care Institute is a participating provider in the IMED plan. The gap insurance is an optional benefit. Again, this means it is employee paid. This benefit can offset inpatient and certain outpatient medical expenses. You must be covered by an NSU medical plan before you can elect the gap insurance, and your gap election must be the same coverage tier as your medical election: employee only, employee plus with children, employee plus spouse or family. The premiums shown here are monthly premiums, and detailed plan summaries can be found on the benefits website. This slide provides a quick overview of how gap insurance works to save you money by covering deductible and out-of-pocket expenses for inpatient treatment and for certain outpatient services. If you are hospitalized, gap pays deductible and out-of-pocket expenses. If you require outpatient hospital treatment, gap will pay up to $200 per day. gap can minimize your medical out-of-pocket expenses. The Aflac products are additional options providing employees a way to offset deductible and fill insurance gaps. The products offered are listed here. More information about these policies can be found on the benefits website. An important note about this product election is that it is an indication of your interest in the product. Because premiums are calculated from individual choices and some are age-based, it is necessary to meet with an Aflac agent in order to complete the enrollment. For short-term disability insurance, Accident Advantage, Aflac Choice Hospital Confinement, and Aflac Care Cancer Care Premier. As a newly eligible employee, this is the only time you will have the ability to enroll into the optional group term life plan without answering any medical questions or going through medical underwriting. So if you have had difficulty finding life insurance coverage in the past, don't miss this opportunity to enroll now. You can purchase at age-banded group rates in increments of $10,000. You can purchase for your dependents, and it is portable. You can take it with you should you leave NSU. The benefit age reduces at age 65 to 67% and at age 70 to 50%. LegalShield and IDShield is an optional benefit where you can enroll anytime during the year. It currently provides legal services to more than 3.5 million individuals throughout the U.S. and Canada. Enrolled members can talk to a lawyer for any personal legal matter, no matter how big or small, all without worrying about high hourly cost. It also provides identity theft services in collaboration with the Kroll Advisory Solutions, the world's leading company in ID theft consulting and restoration. For more information, please contact our independent representative, Kelly, by calling 954-214-0327 or emailing Kelly at akasolutionsinc.com. We provide plans for all members of your family. So if you have any pets, you may want to consider Pet Assure with Pet Plus Rex. You must use a participating veterinarian, so check on that before you enroll. This plan provides discounts on in-house medical services and prescription medication, along with no waiting periods or exclusions. Here are more benefits offered to you at no cost. After 3 months of employment, NSU provides you basic life insurance in the amount of 1 times your salary, long-term disability coverage, emergency medical travel assistance, and you will be eligible for the NSU short-term disability program. After 6 months of employment, you'll become eligible for the NSU tuition benefit. Rally is part of our employee wellness program. It is a fantastic digital wellness site that provides a community and engaging experiences that actively support your steps toward improved health and well-being. Rally incorporates its 5 elements of well-being, which includes purpose, social, financial, community, and physical into its unique program. Download the app for easy access to the site, which features include an innovative health survey, personalized activity recommendations, individual goals, and supportive online communities. Link your wearable device to your Rally account so it is easy to track your steps, check your progress, and compete against others in the challenges. Employees, spouses, and domestic partners can earn up to $250 per benefit year by completing these activities. Coins are also awarded so you can participate in sweepstakes for additional rewards. Registration is made at www.myhealthtoolkitfl.com. Create a username and password. Once you log in, click on Rally on the lower left-hand side. Thereafter, you can log into Rally through the ICUBA portal using the single sign-on through Blue Cross and Blue Shield. NSU provides employees with a very robust discount program. This program is an opt-in program, so go to prks.co/Nova and set up a login and opt into the weekly perk notifications. It is never too soon to start saving for retirement, and you can begin making contributions of your own on the first of the month following your hire date. Employer contributions begin in the first pay date of the month following 1 year of an employment. We have 2 investment providers for NSU employees, AIG and TIA. NSU also provides employees free access to financial advisors. So meet with one from AIG, TIA, or CapTrust. You have lots of great resources to secure your future. Use the contribution calculator to determine the percentage of salary you would like to contribute and go to myretirementmanager.com. Make your elections, choose your investment provider, AIG or TIA. NSU makes very generous retirement plan contributions. For example, NSU will make a 2% contribution into your 401k even if you contribute nothing. But if you contribute 4%, the university will put in 10% for a combined employee and employer retirement savings of 14%. While we think of retirement savings in terms of a percentage of salary, the IRS sets their annual contribution limits in a dollar value. For instance, in 2019, you can contribute up to $19,000 or $25,000 if you are 50 years or older. So don't limit your contributions just to the 4% required to receive the maximum employer contribution. Think big and attack retirement readiness like a shark. Begin by going to myretirementmanager.com. Make your elections, select an investment provider, participate in our free financial education seminars, schedule a free financial counseling session, visit the retirement plan website for more information, and in the end, you'll be ready to retire. I wanted to provide notice to you about the family and medical leave, so if you are ever in need, you will understand your rights. NSU may grant up to 12 weeks of leave for one or more of the reasons listed here. Eligible employees will have worked for NSU for a minimum of 12 months, providing a minimum of 1,000 hours of services during the look-back period. Notice must be provided to the university's designated leave administrator. An NSU policy required that accrued sick, personal, and vacation be used during a period of family and medical leave. Short-term disability may be available to an employee with a disability that continues beyond the 12-week family and medical leave. Complete information regarding family and medical leave and short-term disability can be found on the benefits website. You can access your benefit plan information in a simple, easy, and immediate way by using these mobile applications. Stay connected like a shark. Follow us on Instagram at NSU Benstagram and on YouTube as NSU Benefits and Wellness, and stay informed about everything that is new in your benefits world. This is your call to action. Enroll at ICUBAbenefits.org. Use your free preventative care benefits. Join the Rally Wellness Program. Consult with an ICUBA Cares pharmacist and lower your prescription drug cost. Register for Teladoc before you need a consultation. Use your free EAP. Locate the best price for imaging. Start your retirement savings, meet with an investment advisor, and retire like a shark.